Okay, so let me go back then to this hemoglobin A1C. Um, an A1C result of 7% or 7.0 indicates that that person has had an average blood sugar of 170 over the course of the past 2 to 3 months. So take a look as we go down here. Somebody with the A1C of 11, they've had very poor control, not just recently, but for the last 2 to 3 months. So that gives the provider a good idea that we need to make some aggressive changes here in diet, exercise, and possibly medications. Important to note, the American Academy of, or excuse me, the American Diabetes Association recommendation is to have an A1C result of 7.0 or less. That's the goal. Okay, so that's an average blood sugar of 170, and some of you might be saying, well, that seems kind of high. But remember, this is 24 hours a day for 2 to 3 months. So this is after we've eaten a meal, before exercise. So we can have some lower numbers like in the 80s and 90s that might pull this down, and we can have some really high numbers that might pull that up as well. Speaking of numbers that are pulled down, hypoglycemia, that is a common side effect for those with diabetes that are doing exercise, changing their diet, and possibly taking medications or insulin. It's diagnosed as a blood sugar below 70 milligrams per deciliter. The symptoms can be very sudden, and people describe symptoms as shaky, sweaty, nauseous, vomiting, just feeling outside of their body, blurry vision. So it's important when our patients feel this way that we advise them to check their blood sugar. And then if it's below 70, then they should treat with one of the things listed here. Remember, we don't want them to treat with a chocolate bar. Why? Because it's high in fat and it's not going to get into their system quickly enough. Then they should wait 15 minutes, recheck their blood sugar. If it's still below 70, then they should go right back to the slide and do the same thing. If it's above 70, then they can eat their meal or snack. Okay. What we want to advise our patients is to not treat with very high portions of glucose, like chugging a whole 12-ounce soda or 60 ounce of soda or really large portion of juice, because we'll see very high numbers. So now we have the problem of going from very low numbers to very high numbers, and that large swing in blood sugar isn't healthy either. So what's our MNT for diabetes? Well, there's several options. There's using the Choose My Plate method, which might be our first way to approach diabetes meal planning. It's simple, it's easy to follow. But for then, with our patients that require a little more or would like a little more, we can use a method called carbohydrate counting, which you'll look at in the video and then discuss in your discussion board for this week. There is a system called exchange lists that your book outlines, but this is a rather archaic system and not utilized as much. So again, first line of defense is the Choose My Plate, and then for patients that need more, we would do carbohydrate counting, no longer using exchange lists because carbohydrate counting is just so much more efficient. And what carbohydrate counting looks like is we are grouping foods that have carbohydrates into what's called choices. And you all know that foods that have carbohydrates are grains, fruits, starchy vegetables, sweet snacks, and then our milk and yogurt. So around 15 grams of carbohydrate is considered one carbohydrate choice. And we're going to distribute those carbohydrate choices depending on their calorie level. So the example I have here is we have 2,000 calories. We're using 50% of our calories from carbohydrates, so falling right in that AMDR guidelines. So that means 1,000 calories from carbs. You know this math, divided by 4. And then we're going to divide it by 15 because there are 15 grams of carbohydrate in one carbohydrate choice. So this individual would get 17 carbohydrate choices per day. Okay, it might look something like this: 4 choices at breakfast, 2 at a snack, 4 at lunch, 1 at a snack, 5 at supper, 1 at a snack. Okay, work with your client's current meal pattern. If they're not used to snacking, well, then let's not put snacks in there. Okay, if they are used to snacking, then let's try and keep their pattern as close as possible. We'll have some more work with carbohydrate counting in the homework. So